very good evening, everyone. My name is Lidigu. I'm a health and science journalist. And tonight I have the pleasure of moderating this very important conversation. Don't worry, people are still in traffic, others are still looking at the king, Mali amefika. So I'm very sure they'll be joining us. But first, I wish to welcome our guest. Who will introduce himself and tell us a bit about what he does and where he is at the moment so that we proceed like that. So, Mr. Sikuku, welcome.
Hello, this is Dr. Sikuku.
Yes, Daktari, good evening.
Hello.
Yes, we can hear you.
Good evening.
Yes.
Yes, sorry for I'm not not well in tune, but I think you're catching me right.
Yes, we can get you.
Yeah, thank you for availing this chance.
Yes, sir.
Thank you for availing this chance for me. I'm happy that I'm on the platform at this point in time. I'm the director of Lidigu Nursing Home that is situated in Kangeni, Kangara, and Kibera. We are partly serving the community, the unfortunate community, and we've been doing this for the last 8 years. So it's my pleasure that I'm on this platform to educate and advocate for cancer, breast cancer awareness.
Thank you so much. Doctor, if I may just jump into it. When I put the poster up, I was getting a lot of feedback about men saying that they're also testing positive for breast cancer, and there are very many men who are wondering how is this possible. Will you kindly elaborate?
Yeah, your question was men are a bit concerned that they are testing cancer positive.
Yes.
Yeah, so you wanted me to respond to that, and I was responding, saying yes, cancer is testing cancer positive, and I was giving the reasons why this is possible. Is that okay?
Very much okay. Please go on.
Yes, I was saying that men are exposed to a lot of radiation, and mostly these radiations are emanating from the environment. Secondly, the lifestyle they are leading, especially the eating processed food, and also some of them they are obese, and also they are exposed to taking alcohol and smoking. So the lifestyle basically, and the inheritance, sometimes it runs into families. These are the components that are making men now be really exposed to cancer of the brain. Hello?
Yes. Doctor, every time we talk about cancer in this country, we promise to build hospitals. We usually just talk about it when someone prominent dies. Is when we remember someone prominent has died of cancer. It is bad. But this is a disease that Kenyans are grappling with every single day. What are we not getting right?
What we are not getting right is that we are not doing proper advocacy. That's from the grassroots to the policy makers. Reason being is that the money that is channeled towards campaign and awareness of such like in a disease is now channeled to other sectors because of maybe poor planning, and also we are not involving the medical fraternity, the people who understand the disease carefully. They're not involving them in the planning, in adjudicating and dispensing the plan. So that's where we're getting wrong. I think that's the first thing. Secondly, we don't have sophisticated equipment in the country to detect the problem in advance. For instance, mammogram is a very good scan that detect cancer cells like in a period, in a couple of periods to be surfaced. So when you have well located in all facilities, and also we take care of the poverty, because this is the infection that is also the disease that is also really affecting the marginalized. So if we get free services, free attention, free, it's very expensive. The inflation is very expensive. So when we channel our finances properly, and so when we channel our finances effectively to the right people, then also we sit down with the policy makers, then you find that we'll get a solution to this.
Thank you, Doctor. Now, you mentioned that you're working in a resource setting. How has the experience been for you? What are you seeing? What are women who are grappling with this disease having to deal with, and how are you adapting to the situation on ground?
Currently, there's a network working. Maybe you just repeat again.
Yes, I'm saying you mentioned you work in a low resource setting. So I'm just wondering, what is the situation like in the community that you are dealing with every single day? What are the women telling you who are grappling with this disease?
It's totally, the situation is pathetic and unfortunate. Reason being, in fact, recently I got a woman. The cancer is almost stage 4, and she didn't know that she's having cancer. Immediately she appeared to me. I saw she's been going for treatment, for checkup, for what, but there were no investigations that were carried out. So this one just a clear demonstration that poverty is also adding some advancement in the disease. And when people they discover they are poor, the management of the cancer itself in terms of treatment like chemotherapy, like screening, is expensive venture. So you find that somebody just decides to take painkiller, and this person will just die, because you see, when having such a disease, also it drains a lot of blood from somebody. So you find that at the end of the day, this person will not go for transfusion. It's expensive. At the end of the day, this person will not have money, and you see this person die poorly. So what I can just say is that those who have money, they make it. They prolong their life, but the poverty of it, they will die very poorly and very fast.
So unfortunate to hear. Dr. I'm just wondering. Sorry, I'm just
Hello?
wondering. Yes, I can
Yes.
hear. I'm just wondering. Um, when you look at how
Hello?
the of this disease in the country, that different regions to deal with
Pardon?
different types of cancers more prominently. For
Hello,
example,
sir?
Western Kenya, you'll find many
Hello?
throat cancer. You come to other regions, you find increasing cases of breast cancer. Why is this the case?
Kindly, I didn't get you. I've just got to need the last part of the question.
Yes, I'm saying when you look at Kenya, as per the
Mm.
data from the official sources,
Mm.
you certain regions find, like, for example, if you go to Western Kenya, they are
Mm.
increasing. I've never understood. If you look at other regions, you'll find these ones are dealing with cervical cancer more. The other regions are dealing with breast cancer more. What is usually the prognosis for that?
First of all, the prognosis of cancer is poor, is bad. So, secondly, the regional diversity. determines the types of cancer. This is because there are people, cancer itself runs into families, sometimes genetically spread. So you find that the type of the food, the lifestyle in those regions, the activities they involve in also determine the type of cancer. Because, for instance, you mentioned about cancer, you might find some regions that are very, 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 just to take an forward example, you find regions that there's a lot of polygamy involved. And this polygamy is involved because you find that this kind of human papillomavirus is sexual transmission. So you find that if that region is highly involved in polygamies, so you find that this human papillomavirus can be spread so fast and therefore causing a lot of cancer. You go to regions like maybe for instance like Embu, Meru, you find that people have a lot of cancer of the skin. Those means that there are some things, there's some exposure or some things that are being exposed in those regions that are catalyzing the behavior and or maybe the spread of the infection. So in some runs in environmental plans, at this point in time, there's something called climatic change. There was a meeting that was talking about climatic change. You find that was not addressing only planting of trees, but it was addressing the what is happening on the ozone layer, the radiation of the ultraviolet rays. When they land on the skin of somebody, they also cause they expose somebody to cancer of the skin. So what am I trying to tell you is that different food, different lifestyle in different regions, different behaviors also determine cancer that can prevail in those regions.
Thank you so much. Very, very explained. Now, let's move to molecular testing because as we speak, there are countries. I'm talking about cancer, molecular diagnostic test. Hello, can you hear me, sir?
Hello?
Yes, hello. Can you hear me?
Hello?
Hello? Yes. Can you get me now?
Yes, I'm getting you.
Yes. So let's talk about molecular diagnostic testing, especially for breast cancer. And this is where you've just mentioned a patient comes, they find they're already in stage 4. Do you think we are well equipped for early detection in the sense of molecular diagnostic testing tools? I know we have the molecular imaging center, the integrated molecular imaging center at KUTRH, for example, but how well equipped are we to address these issues, especially for women?
My brother, I can tell you we are not well equipped. Reason being, you can only say I'm well fed or I'm satisfied when you have food at the exposure. So if this all equipments and molecular testing equipment they are not disseminated up to the far end reaching person, to the regions, to the community, maybe having some diagnostic centers in different region, counties, you find that that one is an exercise in futility. Why? It's because that one is for the able people, for the rich people. But the poor people who cannot travel to Nairobi, who doesn't know where Nairobi is, these facilities, it's an exercise in futility. So we are not well equipped for that. And this is an unfortunate situation that is also catalyzing the spread of an infection of the disease.
Thank you very much. Now, 25% of patients, this is according to the National Institute of Health, 25% of patients diagnosed with breast cancer in Kenya are diagnosed with metastatic disease at initial diagnosis. Uh, what is your take on this, and how does it pan out, Daktari?
Just kind of repeat the question.
According to the national
25%?
25% of patients
Hello?
diagnosed with, yes, 25% of patients diagnosed with breast cancer in Kenya are diagnosed with metastatic disease at initial diagnosis. What does this mean, and how does it affect how we are handling breast cancer cases?
This one is just a total indication that the infection is spreading so fast in the body of somebody, and a clear indication that the way we are handling it is a poor is poor. We could be rating up to maybe a 5%, but 25%, that's a quite big number. Reason is the mechanisms, the early detection part of it is poor.
Uh-huh.
They find that with this early detection of the breast cancer, if it's not done, therefore the whole exercise will be not be successful. So this, for us to bring down this, we need to enhance early detection, and then this one will take care of things that are moving in the body spread, and before we go to supportive measures.
Okay, Doctor, recently I was doing a story, and there's an expert who told me that
Hello?
they were not. Um, recently, I was doing a story on cancer, and there's an expert who told me that they are increasingly recording cases of multi-drug resistance breast cancer genes. How does this work out? He talked of something called ABCB1, if I
Yes.
my memory is right.
Hello?
Yes.
Yeah, a lot of resistance is coming now. Hello?
Oh, yes, sir. We can hear you.
A lot of resistance is coming up because of many reasons. One, the fact is that cancer is a terminal condition. So when you get something like resistance, it's quite challenging in a sense that when we are treating this cancer, we're trying to prolong life, or we are giving prolong life, but it's not a condition that this surgery is not assured that we are going to treat it and somebody will get healed, because the survival rate is very low. So the resistance are coming up because of three reasons. First of all, people are taking a lot of precautions. Secondly, they are taking a lot of herbs, they're taking a lot of drugs. So somebody's not making a right diagnosis at the initial point of it. So before somebody comes that is cancer, you get a lot of resistance of treatment. Secondly, the way I've just put it is you'll get a resistance because there are many drugs that are coming on market, and everybody, this one is survival for the best. You want to rush and pick different treatment to see whether it will save you. At the end of the day, you're mixing drugs that will also affect the drug on performance. So you find that there are a lot of resistance because we are not really working on the initial in the initial start of the disease is not well addressed. So you come at the end part of it before you discover is this condition. It will become resistant to drugs. It will the food, the lifestyle. Like for instance, you tell somebody, please, this lung cancer, don't smoke, but somebody will go and hide and smoke. Therefore, you find that this condition will not go. It will be resistant because of the lifestyle. the food we are eating. Secondly, the food that we are eating is GMO, is hormonal based. So you find that this one is also catalyzing or increasing the multiplication and also the multiplication of the cells. And when they feed so well, the cells feed so well, they'll multiply so fast. So you'll get a lot of resistance. So the food, the climatical change, the lifestyle, and also the exposure to traditional drugs, they are also making this condition be resistant.
Now, I also learned that a proportion of patients with breast cancer usually relapse. And I spoke to some who are telling me that, even experts such as yourself, Daktari, are also using them as guinea pigs. They try this new therapy has come, they see it's not working, they try another one. So you find a patient subjected to even three different therapies. What are the dangers of this?
Yeah, the dangers of this, first of all, is expensive, because when you try different approaches on a client, that one is definitely going to eat to the pocket of the client. Secondly, you find that cancer has its own protocol of treatment. If you've discovered early, you will now handle it early. But if you discover it late, you'll not handle it appropriately. Reason being, you'll not have done the right diagnosis. You've not done the right detection. So you find that if you do, for instance, you carry out a surgery, immediately you carry out a surgery, it should be followed with like chemotherapy, or it should be followed with radiation, so that you kill the might be existing cells in the lymph nodes. So if you don't do that, you just do only the surgery, then these cells will come up again. So it's a chronological of events whereby you do this to safeguard another one, to safeguard another one, another management. So you cannot just rely on one management with cancer, because cancer is a condition that spreads so fast. The cells spread so fast, and basically you should have a proper line of approach, that you diagnose, you go to, maybe if surgery is an option, then you give chemotherapy to kill the first existing cells, maybe the cells that have hidden somewhere. If not so, then you use radiation. Radiation is these are X-rays, the rays that are meant just to go and kill the first multiplying cells in the body.
Thank you very much. Interesting. Allow me to take you a bit back about who really gets breast cancer. And according to the Bureau of Cancer Prevention and Control in the state of New York, they are saying all women can get breast cancer. Although the causes of breast cancer are still unknown, there are some factors that may increase a woman's chance of getting the disease. Now, number one, of course, is getting older. Number two is very interesting, and that's why I would love your elaboration on. Is saying having a first menstrual period at a young age, younger than 12 years. Dr. How
Yes.
is
Hello?
hello?
Yes.
How is having first menstrual period at a young age is a factor that may increase a woman's chances of getting the disease?
Yeah, you find that menstrual period at a young age can increase the chances of a lady getting menstrual period, because you see, when the menstrual period start early, that's an indication that this lady is having some change of hormones in the body. And you see, the breast have some two important elements. First of all, it has some lobules. Lobules are the ones that start manufacturing milk, and there are also some apparatus in the breast called ducts. Ducts, they are the channel that carry milk, milk from the breast to the nipple. So if as young lady start menses early, this is an indication that this lady is having some hormonal change in the body. And this hormonal change in the body sometimes also they partly adjudicate or maybe increase the chances of exposure to different levels of cancer. For instance, I just want to move you a bit from cancer to the cervix, to the cervical cancer, whereby if this lady now has matured, you'll find that now she'll start engaging into early sex. And when she starts engaging into early sex, therefore she'll be exposed to human papilloma virus, and therefore she'll get cancer of the cervix. And such a like behaviors will tell you that this lady is exposed in different avenues to the cancer. Secondly, it's something that runs in the family. Cancer can get you at any age, may it be early or late. That one can run into family. I think that's my little knowledge about that answer. I don't know if I've put you right.
Thank you very much. Yes, on the right track. Now, correspondingly, starting menopause at an older age, older than 55 years old, would you explain it?
Yes, yeah. Starting menopause at an older age is also an exposure to cancer, because now you see the hormones that make add value to a woman, they are now diminished. That's estrogen and progesterone. When they start going, this lady is exposed to different cancers. Secondly, older age, the immunity system has gone. So this person is also exposed to different attacks of cancer, because now the predisposing factor, she's being predisposed to different types of cancer. Another issue is that they are different, the exposure of the lifestyle, the exposure of maybe of different infection. Maybe she might be diabetic, HIV positive. These are exposures that can make somebody at older age also be very vulnerable to the cancer attacks or cancer cells. And you see, kuishi kwingi ni kuona mengi. Maybe this person has stayed for long and has been exposed to a lot of radiation that are emanating from the environment, emanating from maybe the food. Some of them tend to warm food in the microwave, just eaten for some time and it's been exposed to this condition. And also, guessingly, the people who take a lot of alcohol and maybe smoking, they're all the people. This young generation is still trying, but they're all people they have taken for long, and therefore they are really exposed to this cancer. So basically, where our age is also a factor. Hormonal part of it can affect lifestyle, can affect the exposure to radiation, can expect and any can expose somebody to such a like a happening. And back to our first issue, she has maybe several sexual partners. Therefore, human papilloma virus can also be exposing this person to cancer.
Thank you so much. Now, another interesting one is never giving birth or giving birth to a first child after the age of 30.
After the
Age of 30.
yes.
When is
Now,
the time for a woman to give birth? Let's start from there, Doctor.
at when is
The appropriate time for a woman to give birth.
no appropriate? There's not really appropriate time of a woman to give birth, because if somebody starts engaging,
Yes.
these two organs, they are active, so they cannot really prevent. They cannot refuse to accept the indulgence. So
Yes.
so it's
But
really but you see, the essence of wanting somebody to give birth when she's mature, the
yeah,
organs are mature, is because first of all, at a young age, the pelvic region or the organs are not mature. Therefore, this person can be exposed to a lot of maybe injuries. But when somebody is mature, and the organs are okay, the uterus is okay, the birth canal is okay, then you'll find that this person now is very, very, very ready to give birth. So I cannot give a definite age, but anybody above 20, 18 to 20, and the breast have developed, the uterus is intact, the birth canal is mature, then that person is okay to give birth, but not at a young age. Giving medicines, starting medicines, that's an indication that this person is starting, the organs are starting to mature, and it's very fertile to get pregnant at any age. Nowadays, kids get pregnant at 14 years. And I think it's because of the food they eat. So getting pregnant, that's a challenge. That's at any point.
Yeah. And now, when they say that if you never give birth, never giving birth, it increases your chances of getting breast cancer, and also giving birth to a first child after the age of 30 increases your chances. What should women do?
No, I think those are just talks that also should be talked on along the street, because uh, many people don't give birth. Many people don't give birth at certain age, and if that could be the reason, then everybody around us could be having cancer. But one thing I want to tell is that the lifestyle is determining. Secondly, the hormonal part of it. When you're breastfeeding, you're also exercising the human ability. Secondly, these people, when they are going to the clinic for antenatal clinic, they are given some education on breast examination. So with them, they can easily early detect anything that is abnormal. You see, that one is also added value. But somebody who has never given birth will never go for breast examination, for breast education. Therefore, things will just happen anyhow, and this person will be a subject of the matter. Also, secondly, the hormonal part of it, when you release, when this madam or the person who is breastfeeding, when the milk is being injected out of the breast, you see the hormonal change also prevents the hormone that comes that manufacture milk. This one also prevents the occurrence of such a like thing, because when she's breastfeeding, that's also an exercise to the breast. When the child is sucking, that's also an exercise to the breast. Therefore, you find that any abnormality can easily be detected, and therefore you can take some pressure. I think that's how I can approach the question, because where I'm seated is that cancer is something that is affecting women. Out of 8 women, you'll get one with cancer. So that tells you that it's something. It's a silent killer. So you cannot really tell at which time it will come in, or at which season it will attack. So it's just to be vigilant where I'm seated.
Okay, and then there's a study that was done by the National Breast Cancer Foundation. I came across it I think last year, and it was
Yes.
saying women who use permanent hair dye and chemical hair straighteners have a higher risk of developing breast cancer than women who don't use these products.
Yeah, that's very true. I won't rule out that, because what we are adjudicating and what we are advocating where I'm seated is that the use of these cosmetic things, the use of the lifestyle, is also partly contributing to exposure to cancer radiation, or cancer cells. So where I'm seated is that I will affirm to say that you find that in the olden age, or olden women, they are not exposed to these things, but the newly coming out generation is exposed, because you don't know the chemical makeup of such a product. Secondly, this exposure to different lifestyle, or maybe perfumes they are putting in their body, so that maybe they look differently, chemicals that change their facial appearance, their hairstyles. You don't know what chemical makeup is in those things. So you find that this person is predisposing herself to chemicals that maybe also can affect the skin. And when they start accumulating in the skin, they'll go affect the kidneys, they'll go affect other parts of the body, and therefore they'll change the skin in any behavior. At the end of the day, they land into the breast. Because there are some also there are some people who do funny things on the breast, putting some funny things on the breast. I don't know for their own good reason. At the end of the day, they are also exposing themselves. So that study, I believe it's also very, very, very organized study. That it's also part of us to make sure that we prevent the occurrence of cancer in women.
Yes, Dr. Thank you very much for that clarification. And perhaps someone might be wondering, have established for many years that breast cancer is a common term for a cancerous malignant tumor, which basically, as you explained, starts in the cells that line across the duct or lobules of the breast. And then, does this mean that breast cancer is one singular disease, or it's several diseases that behave differently?
I would affirm to you that that's not one disease. It has different approaches. And
Yes.
those different approaches might be hormonal based, might be maybe chemically based, might be running into family. So one thing I want to affirm to you is that it's not a singular approach.
Mm.
Yes.
And perhaps someone might just be wondering, when should I begin screening for breast cancer? Is it when I notice the lump? Should it be something regular? When is the appropriate time?
I would affirm to you that starting to screen to early detection and also self-examination starts early. Early is that any lady who has grown breast, you can only touch breast when they starting growing. So what it means is that you start early examination. Early examination is that you go for the clinical knowledge, and then you start checking your breast at early age, whereby they will tell you how to do breast examination. An expert will do that, and therefore you'll be doing it routinely. In fact, you can be doing it on daily basis, provided you know your body. The first important thing in all these exercises is to know your body. If you know your body, how it behaves, then you can easily detect any abnormalities that will come in. So it's good to know from the normal to abnormal. Therefore, it'll give you the signs, how it presents. For instance, I'll tell you that if you see a change of the skin, it almost looks like the peel of an orange. That one is an indication that you need to rush somewhere. If you press your nipple and you see that the discharge is changed, you need to do like if you touch your breast in a clockwise manner, you feel you press, you find that this one something bad is not happening. So early self examination is a technique.
Interesting. Daktari, just to take you back a bit to what causes breast cancer, there's one risk factor. Hello, Daktari,
Hello.
can yes, Daktari, can you hear me? Hello, Daktari, are you with
Hello.
us?
Hello.
Yes, yes, are you with us?
Yes, I'm there.
Okay. Yeah. So there's something on use of oral contraceptives. How is this a
Yes.
risk?
On.
Use of oral contraceptives? How is this a risk factor for breast cancer?
Yes. Hello.
Hello, Daktari. The question is use of oral contraceptives. How is it a risk factor for breast cancer?
Oral contraceptive is not. I cannot say that is a risk factor as such,
Mhm.
because the usage of this oral contraceptive, that's maybe microgynon. They are very they are things that have gone through a period of standard. They have gone through clear medical channels that have proved they are very good for human consumption. Therefore, I cannot adjudicate and I'm seated to say that oral contraceptive is a predisposing factor, or maybe a family planning is a
Okay.
predisposing factor to cancer.
Okay.
Mm.
Now, if I have touched my breast or my breast region, and I feel there's a lump or I'm suspecting myself, what kind of doctor should I go to look out for when I'm suspecting?
First of all, if you go about looking for doctors, you might miss the mark.
Mm-hmm.
The first thing you do is that you go and see a professional, a medical doctor who understands and therefore explains the way forward. And through that, you'll be now taken through the channels. Maybe if it needs a referral, maybe it needs a screening, you'll be taken through those channels. So if you might be looking for a certain doctor and then you miss, but definitely we have gynecologists who deal with cancer. But first of all, start where you are. Start where you are, because you'll get a lump, go to a medical person, go to a medical facility, or go to the nearby person who will now advise you appropriately, not a chemist. Go to the doctor who will advise you appropriately and therefore take you to channels of management, and that will be right. And going to anybody, or maybe going to a herbalist, maybe going to a chemist, or going to anywhere. But the first is go to a medical doctor. The person is near you. Before this person will take you to oncologist, or say oncologist. Now that one is a specialist who deal with cancer of the breast, or with any cancer, not cancer of the breast, but with any cancer.
Okay. Now, Daktari, let's gossip a bit about your fellow colleagues. I have so far 6 cases this year of Kenyans who went to Apollo in India after.
Hello?
Yes. Hello, Daktari. Can you hear me now?
Yes, yes.
Yes. So I was saying I have.
Hello?
Yes. Hello. I was saying I have 6 cases of Kenyans who were told they have cancer. They underwent all the tests in Kenyan
Hello?
facilities. Hello, Daktari, can you hear
Hello?
me?
Yes.
Yes. So I was saying I have 6 cases of Kenyans who were told they have cancer in Kenyan facilities after series of tests. Some of them had even started treatment. But when they went to India, to Apollo Hospital in New Delhi, the experts told them that they have been misdiagnosed. What would make you professionals misdiagnose someone for something so serious like cancer? And what should someone do upon being told by a second opinion that you
That's
don't?
quite unfortunate.
Yes.
Hello?
Hello, Daktari. Yes.
Hello?
Yes.
Hello?
Yes, I can hear you, Daktari.
Yeah, I didn't get the last part of your question.
Yes.
I didn't get the last part of the question,
I was
but the
asking what.
first question is
Yes. How do misdiagnoses happen? Because it's emotionally draining for patients when you go all the way only to be told that in Kenya you are misdiagnosed. So what should someone do in that state? And some of them have already even started treatment.
that's a major setback that is also affecting the spread and the management of cancer, because first of all, it's totally unfortunate. And the unfortunate part of it is that you find that there are those people also who are masquerading as doctors. That's the first thing. Therefore, they don't give right diagnosis. Secondly, the screening part of it. People who do the screening part of it, they don't follow the right procedure or channels. Somebody's just after money, and therefore give a funny diagnosis, or maybe give not right diagnosis, And you find that that the end result is the mismanagement of the land. So basically, where I'm seated or where I'm standing is that we should be very, very clear in the management of cancer, whereby before somebody goes outside of the country, should have gone through the protocol. The way you just asked me another question and asked me where with this first person after realizing there's a lamp, where will this first person go? First, this person will go to a medical person, a professional, and this medical person will channel to the specialist who deals with cancer. And that person who deals with cancer, therefore, will be able to detect, yes, this one is malignant is cancer, this one is benign, this one is not cancerous, we can do something like this, and then advise accordingly. Then in that event, you'll find that we'll reduce this misdiagnosis. But lastly, also we should come up with the ministry or the policy makers or the policymakers should come up with a way of camping this before somebody leaves the country. Should show the person, the doctor who has made such a recommendation. The doctor is known that is a specialist, not somebody just from a village, just finding picking money and then going outside saying going for cancer treatment. You reach there, it's a benign thing. It's not malignant. Benign is something just a growth that is not cancerous, has no cancer effect. So I think it's also the policy and also the advocacy and also the ministry, the people who are involved in policy making that should come up with a camping measure to take care of this. So I think that's my take.
Thank you. Now, my final question to you, Daktari, before I open the floor to the public who might be having a question. And remember, guys, there's on the right hand side of your screen when you're facing it, there's a heart-shaped icon. If you touch it, you'll see the emojis for raising the hand. Please just use it, and then I'll give you the mic so that you may ask your question, or you can DM me your question, or just tweet us at Minet Lidigu, Minet Kenya, and then at Leon Lidigu, and I'll be able to sample them. Now, Daktari, my final question to you is this. It's actually in two parts. Part one, cancer brings down families to poverty that they never imagined before. How should a family navigate when they're dealing with a cancer patient? From your experience, what insurances would you recommend? How should someone handle the situation? That's the first part. Hello, Daktari, are you there?
Where I'm seated is that cancer is. Are you comfortable for me to respond?
Yes, yes, yes.
Hello?
Yes, yes. Please go on.
Hello?
Yes, please respond, sir. Please
Hello?
go on. Yes, I can hear you. Please
Can I
respond.
respond to the first part or you ask the second part first?
Please
Second?
respond to the first part. Please respond to the first part. Yes.
Hello?
Hello, please respond to the
Respond?
first. Yes.
Yeah. You find that cancer is a condition or is a disease that is really dwelling families, especially to the last part of their coin. If somebody maybe has accumulated wealth, this person will end up seeking different treatments until to the last coin, and at the end of the day, the family ends up in poverty. My take is this: everybody should be on an NHIF platform. NHIF platform, it has an avenue to address such a problems that are affecting people, be it poverty, be it poor people, be it rich people. You find that when you're in NHIF, it will take care of this. Secondly, is the advocacy I'm talking about. When people are educated, when people get sound information about the condition, they treat carefully and very sincerely. Thirdly, is requesting and also asking the doctors to be very sincere. You find that maybe a patient has a stage 4 cancer of the breast. And here you find that because the doctor wants to make some money, will go and operate this patient. And that operation is very expensive. You find that now the family end up selling some things because the doctor has said, the doctor is almost like a small god because the doctor has said will operate on this patient, and that will be going to cost a lot of money to the patient. At the end of the day, because this patient should go under chemotherapy, radiation, which are also an expensive venture for the family, they'll end up poor. So one thing about taking care of this, first of all, take an NHIF. Secondly, those doctors who are not very sincere and really professional, they should stop this because they drain the family. They know that this person will not live for long. They go into doing surgeries. And when these people, they teach these people on the palliative care, then you find that as this person at the end of the day will go, but will go a very honorable death, and also the family will have not spent a lot of money. I think that's also my take.
Thank you very much. Now, my second part of the question is there's a lot of mental health issues attached to this disease. As professionals, do you provide support on the side, or how do you advise people to go? Because I have seen people very depressed, some resolving into alcoholism because of just this disease, and also their caregivers try to it.
Yeah, mental health can resolve with this because you see, when you know you're having a condition that is going to kill you at any time, or maybe it's going to remove you on the world very easily. There's some regrets. Where did you go wrong? Maybe it came from family. Why did I be, or not somebody like that? It ends up depressing you because you're asking yourself a lot of questions. So in the mind of asking a lot of questions, because maybe the conditions are very painful, maybe the condition is the condition is leaving you, going to leave you. Maybe if your family is going to be poor, you are very stressed. It's a stressful moment because of the medicine you're taking, they are heavy. Maybe the food that you should eat, it's so depressing that you want to eat certain food, you start vomiting. The pain part of it is also mental torture. So all these things, when they come, you find that it affects the mental stability of somebody's not health. Therefore, this calls for the caregivers to understand first of all. Secondly, calls for the caregivers to know the reason why the spiritual part of it is very important. Calling for spiritual nourishment, and also secondly, also going for medical counselors or experts who can come and counsel the family, advise them, tell them how the condition happens, and also tell them that at the end of the day, we lose this person because of this condition. So when all these things they are told and they advise, you find that this person will trade treatment, will trade maybe advices, all they care. But if they are just exposed with no explanation, with no counseling, with no spiritual attachment, then you find that also with financial incapability, it will drain the family. Lastly, on just to answer that, it's also the issue of funding. If the government and the stakeholders advance funding and treatment at least for free, you'll find that the family will not be drained, and also it will also not affect their mental instability, and this also will help in also in the process of maybe managing this patient, because at the end of the day, this mental aspect of it will be taken care. This will be a health measure that I think it will be appropriate for such situations.
Thank you so much, Dr. There's just one question from the public. It comes from a lady called Maria, and she's asking, "Hi, Leon, please ask the doctor what please ask the doctor what treatment options are available in regards to breast cancer and if there are any side effects to those treatments.
Yeah, the treatment options that are there. First of all, I could be so happy if she could ask me what is the early detection, the prevention, and the supportive measure. Now she has rushed to the supportive measure, which is okay. First of all, the early treatment is of cancer is your self-examination awareness technique. If you're aware of that, you'll be able to detect the abnormalities. When you detect the abnormalities, you go screening, maybe a breast scan or maybe a mammogram. Mammogram is just an X-ray that uses some special rays to detect some abnormality in the breast, or maybe breast scan is just is the use of sound waves to detect any abnormal images in the breast, and then from there, if anything is detected and the mammogram has been done, you will go maybe something. The next thing it will be done is biopsy. Biopsy is just a measure that we use to pick an abnormal to pick an abnormal mass or lump in the breast. Then it will be taken to the laboratory to be tested. If it's found that it's an abnormal thing that's not is not benign, it's cancerous, then surgery will be an option. Therapy, use of drugs that is given through the vein will be an option. Radiation, the use of rays will be an option. And finally, the removal of the breast or the lump will be an option. That's the removal of the breast is called mastectomy. And the removal of the lump is lumpectomy. So those will be options, the last option on the menu.
Thank you so much, Daktari. In terms of things like surgeries, radiation therapies, targeted therapies, what will be the side effects of this treatment?
The side effect is the side effect is sometimes advanced. Reason being, like you're given a chemotherapy, you're given a chemotherapy. These are drugs that you're given in the vein. You'll find that there are some people they lose their hair. There are some people these are chemical that goes to battle with any fast growing cell in the body which is cancerous. So that means that in the manner of doing that, they'll also be affecting any existing cells. Secondly, if you're using radiation is using some rays that are very very strong, so it doesn't discriminate any cells. There's a change of body. They become weak. It kills maybe the important cells. So there are a lot of changes in the body because of using this. There are some that also the blood level goes down. There are some of them the immunity system is exposed because when you give these chemicals in the body, it kills the good cells and the bad cells. Just in that manner, somebody is exposed, the immunity system is low, and also psychologically, somebody will be so weak. Some of them will be. At the end of the day, these are just measures to prolong their health, but they are not going to heal you from cancer, the cancer cells. So if you have that also mind, also psychologically affected. And at the end of the day, the side effect is also the pocket because it's also financial draining, you see. So it's not something good, but because we want to prolong life, then we adopt it the way it is.
Thank you so much, Daktari. Now, before I close, where can we find you? Perhaps if we need to visit you, or how can we reach out to you?
Yeah, I'm so pleased. Thank you for that. For that, I really appreciate. At the moment, I'm having two facilities. That is Eagle Healthcare, Kangemi, Eagle Healthcare, Kibera, Eagle Healthcare, Kibera, Kaongware, and Eagle Healthcare coming up, Madare. You can realize that my facilities is almost in the slum areas, so that I'll be able to detect any malpractice or any conditions that happen that are not detected because of unprofessionalism. So when you reach in any facilities, through my number is 0722 95 23 81. 0722 95 23 81. If you reach me through that number, I'll be able to tell you where I am. You'll come, we'll sit down, we'll carry out the investigation, we'll do the things like pap smear to the women to detect, and also I'll take you through the exercise of self-examination, self-detection, and screening. Therefore, my patient will be at the right place.
Now, Daktari, now you've brought in a very interesting thing. I have to shoot this final question. You've talked about pap smears.
Yes.
That's one of my favorite topics
Yes, pap smear.
In reproductive
Hello?
health. Yes. I can hear you, sir. So I'm asking, are there any new developments when it comes to pap smears? Because many of the ladies I've interviewed about pap smears, they tell me those things are so horrible, uncomfortable, and all manner of things. Do we have any new technology in terms of the pap smears and how they're being conducted currently? Hello, Daktari. Daktari, we seem to have lost Daktari. As we still find Daktari, are you here? Yes, I can see Daktari is back. It's a network issue. Yes. Yes, Daktari. I was asking what are the latest technologies when it comes to pap smears? Because to be honest, ladies don't like those things.
Yeah, I would sincerely tell you that yes, ladies don't like those things. But to be so sincere enough, that's the most appropriate and the best way, because what we are going to do with pap smear, we are going to pick the abnormal cells, and the only way. Hello.
Yes, I hear you. Yes. Please go on.
Hello.
Hello, sir. Yes, I can hear you.
Hello.
Yes, I can get you.
Well, yeah. It's a discomfort, a position, and adventure, and
Yes.
some of the ladies don't like that. That's very true. But when you know the dangers that are before you, especially the attacks of cancer of the cervix, then it's something that you're not bargain about. So to
Yes.
me, it remains the best approach. To me, that's my best approach.
Okay, I understand. But I'm asking, is there new advanced technology in the manner of doing pap smears that is less comfortable, that is less, hectic? Because the pap smears make a lot of ladies very uncomfortable, and that's why many tell me they don't like them for those reasons.
There's the latest one called Viavili. We use some special chemicals to detect any abnormal cells. But at the end of the day, ladies hate something called a speculum, and there's no way you'll approach that Viavili without using a speculum. So the speculum is what makes all the difference. So you find that they'll just accept it, because it's almost with the when you understand the other gadget, therefore you'll just appreciate it.
So, thank you.
I'm becoming a pastor. That's why I'm talking of the gadget. Therefore, you shouldn't wonder, so what is the gadget?
Thank you so
Yes.
much, Dr. I really appreciate you for your time
Thank you, my brother.
teaching us. We will keep in touch, and we really appreciate you.
Thank you very much.
Thank you so much. Esther, are you around?
Yes, I am.
Do,
Just
do
been
you
paying
love
attention.
do you love pap smears?
Wow. You have to get them at least once a year.
Once a year.
Necessary. Yes.
Doctor, I told you. I told you
Yes.
they don't like pap smears. I know them.
The good thing is once a year, so it's not many times a year.
It's unnecessary. It's unnecessary. We have to embrace it for what it is. Yeah.
Yes. Esther, thank you so much.
Yeah, that's
Yeah, Esther, thank you so much for hosting us. We really appreciate. Over to you.
Thank you so much, Leon. Tari, asante sana. I think what we try to display with this session is, people hear the name Minet and they consider, big names and stuff, but you also want to also showcase that, kuna afya mashinani. Health,
yes,
health can be found, you don't have to go to the big facilities that you feel care is available for the,
yes,
that can only go up to a certain extent. We do have, access to services pia mashinani, so do not fret.
yes,
Tatnafeka is available for you. I think one thing we did not address adequately is that, I think for those who've experienced insurance, maybe they have questions on how much of it is covered. Um, once you have a critical illness such as cancer, some people despair very early and they start considering maybe how much will it cost to get appropriate care. And I think with me, I have dragged a colleague of mine, Judith, and whether she host, we can be able to just make her a speaker, Judith Atieno. Judith, if you're online, you can accept the mic that our host is sending to you. But even as she joins, I think it's critical to always be very open with your provider. That's if you're taking insurance, what level of coverage you're looking for, because some of these things, there are unforeseen circumstances. So it's better to protect yourself a bit earlier because they are what you call the comorbidities. And sometimes for those who don't know how it is applied, they despair a lot, yeah. But you want to just assure members that if you're open with your provider and you know which kind of coverage you're looking for, these are some of the benefits you can hope to have catered for. And sometimes when things complicate further and you get those very disheartening conclusions, such as maybe the case is terminal, we do have critical illness covers. Can talk to brokers such as us to help you, choose a solution that is viable for you, because there's so much that comes with a diagnosis such as heavy as cancer and disability and the likes. But I think those other things that we can discuss in subsequent Twitter spaces. Thank you so much, everyone, for joining us. I'm looking forward to hosting you for another session. We are open to your requests. Remember, we're like your big brothers, big sisters out here to just help you clarify some of the concepts you hear, at least from the medical side, for this session. I think with that, Leon, I have nothing much to add. We can have another session, yeah, on this.
Asante. Have a blessed night, guys. Good night.
Good night.